For over 20 years, we at Bayer Healthcare Pharmaceuticals have been committed to supporting families living with hemophilia A. During this time, we've continued to enhance the treatments that people use while living active, fulfilling lives. This video was developed to help answer some real-life questions you may have about hemophilia A and its treatment.
I still remember how worried I was when they first told us that Tim had hemophilia A. It seemed like all of a sudden he was cut off from the world of possibilities we had imagined for him. Basically, I thought he'd have to live in a bubble. Luckily, I found out that's not like that at all. Tim's able to do many different kinds of activities. So now I tell other people in the situation that the most important thing you can do is learn and keep learning. One of the first things I learned was that people with hemophilia A are missing factor VIII, a protein in the blood that normally helps stop bleeding. This means that they can bleed for longer than normal. And if they have numerous bleeds over time that aren't properly treated, they risk long-term damage to their joints. I also learned that hemophilia A occurs almost exclusively in boys. It's usually inherited from mothers who carry the gene, but sometimes it occurs without a family history. The level of factor VIII activity in a person's blood determines if their hemophilia A is defined as mild, moderate, or severe. Tim was diagnosed with severe hemophilia A.
Hello, I'm a nurse who specializes in hemophilia A treatment. One of the first things I teach parents of newly diagnosed children is how to recognize the signs of a bleed. A bleed happens when blood vessels are injured and blood leaks out. Bleeds can happen externally, like a nosebleed or a cut, but some of the more serious bleeds happen internally, inside a joint or muscle, and are not always immediately apparent. Joint bleeds happen when an injury causes blood to leak into the joints. Blood fills up the space and causes pain, swelling, and stiffness. It's very important to recognize and treat these types of bleeds quickly and prevent future ones, because repeated joint bleeds can cause long-term damage to joint cartilage, and that can lead to chronic pain and disability. Some internal bleeds aren't obvious, but there are established ways to detect them. When looking for joint bleeds, you should compare both elbows, knees, and ankles to check for swelling. The area of a bleed may feel warmer than the surrounding area. There may also be stiffness or pain. Muscle bleeds usually happen in the arms, thighs, and calf muscles. In toddlers, they often occur in the buttocks and groin. Bleeds that occur in the eyes, neck, throat, head, or internal organs are considered major bleeds. These are rare but require emergency treatment. Whenever a bleed is identified, basic first aid should be applied. Superficial cuts don't necessarily require more than an adhesive bandage, but for more serious bleeds, rest, ice, compression, and elevation of the affected body part is recommended. First, rest the child's hurt area. Take weight off the injured limb by reclining or using a sling or crutches. Then apply ice for 15 to 20 minutes every 1 to 2 hours. Compression is achieved by wrapping the area with a compression bandage. And finally, elevate the hurt area above the level of the heart to slow blood loss. Then, contact your child's hemophilia treatment center to determine the next steps.
The first time we recognized that Tim was having a joint bleed, we applied ice. Then we contacted our local hemophilia treatment center where he was treated with factor VIII replacement therapy. A nurse who specializes in hemophilia A care administered it by infusion.
Factor VIII replacement therapy is the standard treatment for joint bleeds and other serious bleeds in hemophilia A patients. Factor VIII therapy replaces some of the missing factor VIII in a person's blood, bringing it closer to normal levels. This helps to control the person's bleeding. Factor VIII therapy is given by infusion at a hemophilia treatment center, hospital, emergency room, in an emergency, or at home. At first, it's administered by a healthcare professional, but eventually by you, and then by your child himself. Factor VIII has been refined many times over the years. The manufacturing process includes many rigorous steps to remove impurities. There are 2 types of factor VIII that are commonly used: plasma-derived products, which are manufactured from human blood, and recombinant products, a significant advancement in clotting factor VIII therapy, which use special genetically engineered cells to synthetically produce large quantities of clotting factor. Factor VIII is often used in one of two ways: on demand or as routine prophylaxis. On-demand treatment, sometimes called enhanced episodic treatment, is given to control a bleed that has already started. Routine prophylaxis is given on a regular schedule to help prevent bleeds from happening before they start. The goal is to reduce the frequency of bleeding episodes and the risk of long-term joint damage that can occur from serious bleeds. A recent clinical study evaluated routine prophylaxis with a specific recombinant factor VIII treatment in children with no pre-existing joint damage. It was shown to reduce the number of joint bleeds by 87% and to lower the risk of joint damage by 83%, compared with enhanced episodic treatment as measured by MRI. MRI is a more accurate measure of joint damage than an X-ray. In the study, there was no difference in treatments detected by X-ray. The most common adverse events in this study were related to central venous access. Inhibitor development was observed in 8 of 64 study patients. Routine prophylaxis treatment may be started after a child has had one serious joint bleed or before they're 2 years old. The decision to start routine prophylaxis involves many variables and should be made in close consultation with the healthcare professionals at your child's hemophilia treatment center.
It's natural that your child will initially have strong feelings about infusions. It took Tim a little while to get used to them. Eventually, we learned some ways to make it easier. Stay calm. If you're calm, your child will feel calmer. Cuddle and reassure your child. Let your child help you set up the equipment for the infusion. Allow your child to cry or yell when the needle goes in. He shouldn't move or fight, but it's okay for him to be upset. Help your child focus on something else, like a toy, a book, a movie, or singing. If your child has siblings, you'll also want to think about how you talk with them. It took me a while to understand that Tim's hemophilia A was affecting his sister too, and that I had to be sensitive to his sister's feelings about Tim's condition. I've learned it's really important to recognize and acknowledge the needs of all your children, and be sensitive to the fact that sometimes they'll feel left out or jealous of the extra attention that their brother's getting. They might even feel guilty about being healthy. It's not always easy, but try to treat the kids equally when it comes to expectations and discipline, and the ways you show your love. Also, try to keep your family up to date about what you're learning about hemophilia A, and encourage them to talk about their feelings, ask questions, and voice their concerns. Another question that you'll soon have to face is whom to tell about your child's hemophilia A and what to tell them. Because I had to work when Tim was young, I put him in daycare part-time when he was 2.5. I had to explain the basic facts about hemophilia A to his teacher and school director. With people who take care of your children, you'll want to talk about which physical activities are appropriate for your child, how to protect your child during physical activities, which physical activities to avoid, how to spot bleeds, basic first aid for bleeds, how to contact you immediately in case of an injury or suspected bleed. You'll want to communicate these basics to babysitters, daycare workers, other parents, and anyone on the teaching staff at school. I know it's difficult to look into the future right now, but you could take comfort in knowing that your child will eventually be mature and confident enough to administer his infusions himself. Tim is learning how to self-infuse his routine prophylaxis treatment. He's training with a nurse and practicing with the Bay Cuff, a self-infusion training program that helps him get more confident and comfortable before doing a real infusion. Learning to self-infuse is making him proud and giving him a greater sense of control over his hemophilia A. One thing about Tim is he keeps himself very active and gets plenty of exercise. That's especially important for people with hemophilia A because it helps strengthen the muscles that support and protect their joints. It may feel overwhelming now, but eventually your child will learn to live comfortably with hemophilia A, and like any other child, find the things he loves to do.
Bayer would like to thank Susan Zappa, Bleeding Disorder Nurse Coordinator at Cook's Children's Medical Center in Fort Worth, Texas, for her expert opinion and guidance in making this video. We hope this video has helped answer some of your questions about hemophilia A. We at Bayer Healthcare Pharmaceuticals are committed to providing comprehensive support and treatment for people with hemophilia A, and will continue to search for new and improved ways to bring you these resources.